Welcome to today's explainer. As we were digging into the source material for this one, it hit me. The secret to capturing those truly exceptional ultrasound images, it's not just about pushing the right buttons on the machine. It is all about physical spatial awareness. Today, we're going to explain how mastering this strength improves patient visuals and gives you incredibly clear sonographic images. We are essentially going to bridge that tricky gap between what your hand is actually doing and what your eyes are seeing on the screen. So here is our anatomical game plan for today. We'll kick things off with the orientation foundation. From there, we'll travel down the urinary tract, visualizing the kidneys, scanning the urinary bladder, and locating the elusive ureters. And finally, we'll wrap the whole thing up with some key ultrasound takeaways. All right, let's jump right into Section 1, the orientation foundation, bridging the physical and digital. Okay, so every great exam absolutely has to start by bridging the physical space, right there at the bedside, with the digital space on your monitor. And our most crucial tool for this? The probe marker. It's an actual physical indicator on the ultrasound probe itself. Now, for you to generate an accurate on-screen orientation, this marker has to correspond perfectly to the patient's anatomy. Think of the probe marker as your physical anchor. It dictates exactly how that 3D real-world space translates into the 2D sonographic image on your screen. Bottom line, if you lose track of the marker, you've completely lost track of the anatomy.
Moving right along to Section 2, visualizing the kidneys, perfecting the flank approach.
Kidneys are actually fascinating to scan, mostly because they sit obliquely super deep in the retroperitoneum, and that specific angled position means we've got to be really deliberate with our probe placement. So to get that perfect longitudinal or long-axis view, you'll follow a few steps. First, get the patient lying supine. Second, place your probe right in the flank, usually somewhere along the mid-axillary or posterior axillary line. Remember, because the kidney sits at an angle, you have to use an oblique orientation to match it. Finally, direct that probe marker straight toward the patient's head. That right there is how you align the technology with the anatomy to really strengthen your patient visuals.
But wait, if you want to see the whole picture, the sources highlight a really simple but absolutely critical move. You have to rotate that probe approximately 90 degrees.
And boom, just like that, by doing that rotation, we enter the transverse kidney view protocol. Now, your probe marker should be directed toward the patient's right side. It's crazy how this one simple physical rotation completely shifts our sonographic perspective. But here's the catch. You can't just hold it still. To assess the actual full structure of the kidney, you have to physically sweep the probe through the entire organ. We're talking top to bottom, upper pole all the way down to the lower pole. Sweeping is literally how you make sure you don't miss a thing.
Let's head down to Section 3, scanning the urinary bladder, navigating above the pubic bone.
Okay, pro tip right out of the gate. The text strongly suggests scanning a comfortably full urinary bladder to get the absolute best acoustic window. Now, understanding the difference between our two primary views here is huge. For the sagittal view, you want to place the probe just above the pubic bone and make sure the marker is directed toward the patient's head. Simple enough, right? Then, for the transverse view, you take that exact same sagittal position and just rotate the probe 90 degrees, bringing the marker toward the patient's right side. It's amazing how that simple physical shift of the marker entirely dictates whether you're looking at a sagittal or transverse image on the screen.
But honestly, just getting the view is not going to cut it. Just like with the kidney we talked about earlier, full sonographic visualization of the bladder requires motion. You've got to actively sweep through the anatomy in these planes. So when you're in the transverse view, sweep from superior to inferior, and generally make sure you're scanning from one side to the other and from anterior to posterior. This kind of comprehensive sweeping is how you take a 3D structure and successfully map it onto a 2D screen.
Next up, Section 4, locating the elusive ureters, tracking the narrow pathways.
Let's be real for a second. Tracking these narrow pathways can be a massive headache. Ureters are tiny, and they absolutely love to hide behind bowel gas. But thankfully, the sources outline a really nice, systematic physical trace so you can maintain visual continuity. Step 1, start up high by identifying the renal pelvis. Step 2, follow the expected downward course of the ureter. You're basically tracing the anatomy as it drops down. Step 3, assess the distal ureter down near the urinary bladder. And finally, step 4, visualize the uretovesical junction, or the UVJ. By physically tracking your probe along this exact pathway, you massively maximize your chances of actually catching these elusive little structures.
Oh, and I absolutely love this fascinating pro tip from the source material about the UVJ. If you flip on color Doppler while you're over the bladder, you can actually watch literal jets of urine as they are expelled from the ureters into the bladder.
I mean, I had no idea it was so visually dynamic. It's such an incredible, real-time way to confirm your anatomy right there on the monitor and seriously upgrade your sonographic images.
And that brings us to Section 5, Key Ultrasound Takeaways. Physical placement equals digital clarity.
We've essentially just traced the entire urinary tract from the kidneys all the way down to the bladder. And honestly, it all circles back to one cardinal rule of scanning axes. If you're in a longitudinal scanning axis, the fundamental rule is that your ultrasound beam follows the organ's long axis. Whenever you need to switch to a transverse scanning axis, the principle is just to rotate your probe about 90 degrees to that long axis. Whether you are deep in the flank looking at a kidney or right above the pubic bone looking at a bladder, these exact same geometric principles apply.
Which leads us perfectly to the core thesis of all our source material today. Correct probe orientation equals a better ultrasound examination. It really is that straightforward. If you want the best possible images, you absolutely must confirm your orientation using both the physical probe marker in your hand and the resulting anatomy that pops up on your screen. When those two elements are perfectly in sync, your diagnostic capabilities are going to skyrocket.
So, I want to leave you with a little something to chew on before you head into your next shift. How will you translate physical spatial awareness into the perfect sonographic image during your next examination? Just remember to always check that marker, align it with the organ's axis, and confidently sweep through the anatomy. Thank you so much for hanging out with me for this explainer, and hey, happy scanning!